There is a country in this very world that is the size of Telemark County, but with a population of 2 million people. What country, you ask? Lesotho. Lesotho is a beautiful country with mountains dominating the landscape. This makes the terrain difficult to travel in, and medical aid uses small airplanes and ATVs to access the country. In later years, the number of people affected by HIV and AIDS has increased with such an amount that 1 of every 10 people you encounter in Lesotho is an orphan child. Many of these children lost their parents to this terrible, incurable disease and are themselves infected by it. The people of Lesotho are not very wealthy. 49% of them are living below the poverty line. Neither do they live very long in Lesotho. Life expectancy is estimated to be 48 years. No wonder, considering that 23% of the population are affected by HIV and AIDS, and that there are 22,000 patients for every doctor. In comparison, there are only 224 patients for every doctor here in Norway. HIV is a virus that attacks the T cells in the body's immune system and makes the body unable to fight off infections and diseases. When left untreated, HIV can lead to AIDS. There is no cure for HIV, but with antiretroviral therapy it can be controlled. Lesotho has the 3rd highest HIV prevalence in the world, at 23% among adults aged 15 to 49. Lesotho has been affected by drought for many decades, this year being one of the worst. A large part of the population live on farming, so this has left many people in desperate need of food. In a family where one or both parents are dead due to HIV, children are especially vulnerable. The Red Cross distributes seeds, vegetables, fertilizer, and necessary tools to households in the most severely affected areas. As mentioned before, Lesotho is a country dominated by steep roads and high hills. A consequence of this is that many of the people in need of medical assistance find it difficult to travel to places where this is given. Poor infrastructure and shortage of supplies of the facilities hinder healthcare workers from performing their duties effectively. Dissemination of information and education about HIV and AIDS treatment is necessary to prevent contamination and to discover serious medical reactions in patients who are under treatment. Myths exist in Lesotho, and some people use these myths as a source of knowledge on how to cure HIV and AIDS. One of the myths states that one can be cured from HIV after having a sexual encounter with a virgin. The lack of medical knowledge among the population can create challenges for nurses. Patients may deny medical assistance because of the idea that they have a better solution to the problem. There is a general lack of medical staff in Lesotho. Around a quarter of the nurses leave their posts to seek work elsewhere, and another quarter of nurse attrition is due to death. There are also few options for medical education. Many has to leave the country to get an education in medicine. Doctors educated in other countries often don't come back due to the lack of opportunity in specialized medical training in Lesotho, and the stigma of working with HIV-infected people. A recent study shows that healthcare workers are afraid of contracting HIV from their patients and that this affects their delivery of services. Administrators in the handful of district hospitals wait for months or even years for the central government's okay for such a thing as repairing holes in the ceiling or replacing a much-needed doctor or nurse. Living with HIV is a huge challenge, both physical and psychological for the ones infected as well as their families. Stigma and discrimination is an additional burden to the illness. An increasing number of patients are met with both physical and mental abuse and discrimination in close relations. Many people are afraid they will lose their job if their boss finds out. Healthcare workers are also faced with stigma and discrimination. HIV and AIDS has almost taken the lives of a whole parental generation in Lesotho. This causes 130,000 orphans. Most of these lives with their grandparents or relatives. Red Cross also has an aid program directed to these children. This aid program is called OVC, Orphans and Vulnerable Children. Despite expressed anxiety about their children's future, various studies have shown that very few parents living with HIV make plans or provisions for their children's future. In Lesotho, Clowns Without Borders South Africa has addressed the psychosocial needs of orphans and vulnerable children's guardians and community caregivers affected by the HIV/AIDS crisis by incorporating drama, storytelling, song, circus, arts, and mindfulness-based stress reduction. Learning coping mechanism for stress and grief, the QWBCA develops emotional well-being and resilience for those impacted by the pandemic. Their goal is to enable vulnerable populations to cope and become socially responsible citizens with restored hope for the future. Nursing involves taking care of patients' physical, psychological, social, and spiritual needs. What would Florence do? What would Virginia do? Or smart teachers? Rich countries like Norway, with generous supporters like Sondre Lerche and rich people like Olav Thon, and raising campaigns sends money to Lesotho. The Red Cross, hospitals, food, water, support groups, family support, Red Cross contacts in every village, Clowns Without Borders South Africa, training programs for nurses, inhabitants, building houses, all effort makes a security net for each individual. Every village in Lesotho also have a contact connected to the Red Cross who can provide the psychosocial needs for the children via communication, counseling groups, support networks. Local government efforts, in addition to the global engagement, makes many people experience quality of life and increased survival in spite of HIV and AIDS.